I can't live this way anymore. These nightmares are unbearable.
I don't know why I don't feel safe anywhere. I just stay inside. None of it makes sense.
I have to try something else. Nothing has worked. My relationships are broken.
These are the voices of post-traumatic stress disorder or PTSD. Post-traumatic stress disorder is a mental health condition that can be developed after exposure to a traumatic event, like combat, a natural disaster, a car accident, or sexual assault. It's normal to have upsetting memories, feel on edge, or have trouble sleeping after a traumatic event. But most people start to feel better after a few weeks or months. If it's been longer than a few months and you are still having symptoms, you may have PTSD. PTSD can happen to anyone. It is not a sign of weakness. According to the National Center for PTSD, around 1 in 2 people will go through a traumatic experience at some point in their lives. Women are more likely to experience sexual assault and child sexual abuse. Men are more likely to experience accidents, physical assault, combat, disaster, or to witness death or injury. Our emotion depends on many brain areas. The most important are the amygdala, the hippocampus, and the prefrontal cortex. The amygdala is the part of the brain that alerts the organism to life-threatening situations. For the individuals with PTSD, it is hyperactive. The prefrontal cortex, which is the responsible for the conscious awareness of emotional states produced by the rest of the limbic system, especially the amygdala, it is hypoactive. And the hippocampus, which plays a role in providing a context for the emotional memories, it is also hypoactive. There are 4 common symptoms related to PTSD: re-experiencing, avoidance of situations that are reminders of trauma, emotional numbing and persistent negative thoughts, and arousal and hypervigilance to threat. The good news is that PTSD can be treated. Prolonged exposure therapy is an evidence-based treatment, which means that it has been proven to be effective or more often than other types of treatments. During prolonged exposure therapy, the person with PTSD tells the story of the trauma from memory. The person repeats the story to the therapist, and eventually the story becomes less powerful. In another part of PE, whatever people avoid because of the fear, they practice facing it as part of therapy. PE doesn't take that long. It usually takes 3 months of weekly appointments. Sometimes it can be quicker. Sometimes it can be a little longer. But the most important is that it is effective for most people.
It's a very intense therapy, but it is by far one of the most important because I probably wouldn't be here had I not done the therapies.
Prolonged exposure is essentially, I have PTSD because of this. Okay, well, we're going to put you in a similar situation and you're going to come face to face with this. And over time, you're going to be able to get closer and closer.
The
prolonged exposure therapy was the best. The toughest, but the best. I felt like this thing was chasing me and it was a big ugly monster after me, and then I turned around and it was really just a mouse, once I faced it and confronted it.
PTSD symptoms do not have to last a lifetime. People can start to live again. It is never too late to get help. To learn more about PTSD or how to get help, visit the National Center for PTSD website at www.ptsd.va.gov.